Good afternoon, everyone. Welcome to the work session, May 15th. Wait, time's flying. First item on the agenda is a presentation from the Stark Task Force. Beth, you're up. Why don't you come up and join us at the table? I think everybody's got their copies, so.
Really? Because I have plenty.
Okay. Well, it's always easier, yes, as long as you have them printed.
I have them printed.
That's wonderful, because
What?
we're just spinning.
You're just spinning and spinning and spinning. Okay.
It's refreshing.
Thank you.
No problem.
Thank you.
Thank you. How are
Gee,
you doing?
fancy meeting you here.
Thank you.
Thank you.
You? Boy, I had exactly enough.
This might be yours with notes written. I think you have
Maybe
the
I
same
have.
notes written on.
Okay.
You did.
Okay. Please speak into the mic, okay.
Yes, we all have our tags.
Okay, to speak into the mic.
There you
All right.
go.
Well, thank you for having me. And I'm here to share with you the recommendations that the START Task Force determined were right and necessary steps to address the opioid epidemic. And so this first page, well, let me back up. What the mayor charged us to do was to come up with things that his office, that the city could do to address the opiate epidemic. And while there are larger things that can be done, we were to focus on what the city could do. So that's what we did. So this first page, the recommendations for the mayor's office, this, I unceremoniously said, Mr. Mayor, this is your to-do list, this first page. The crisis, there is no crisis intervention team from midnight to 8. There is no one to help, there's no one to call. The COAT team and the Eastern Shore Crisis Response Team shut down at midnight. So there are no crisis intervention services available from midnight to 8, which really is the witching hour, or the witching hours. Chief Duncan brought that to our attention at the very first meeting, and we just couldn't find any way to solve it without creating a funding stream. So a funding stream has to be found somehow, some way, so that gaping hole is filled.
Do you know what the amount is for that?
I have no idea.
Can we get that? Can we work on that?
Sure. Thank you.
And that's 7 days a week?
Mm-hmm. Yeah.
What's the general makeup of the team?
A crisis response team, you would want a social worker. I would think you would want either a peer support specialist or an addictions counselor on the team. The entire COAT team is made up of peer support specialists, so that would probably be sufficient. But again, there's no funding for them from midnight to 8.
Okay.
Okay. There's the only detox, there are 2 detoxes currently in Wycomico County. One of them is Hudson Center. And the availability of detox beds is depending on availability and funding. And then there's the jail. Warden Calamarakis says they've got the biggest detox facility going, but they don't have any real resources to address that problem. So there is no detox service available. We have not been able to, in any venue that I've participated in, get much of a response from the hospital. in terms of starting one. So I don't know how that would happen, and I don't know where it would happen. But we don't have anything but Hudson Center, and the need is greater than their capacity to serve. There is a lack of support for and treatment for adolescents. The adolescent programs at the health departments are small, if at all. In terms of recovery support, we have not been able to get much of an Alateen program going on, which is a 12-step program for adolescents. No one in those fellowships wants to take that up, and unfortunately, the face of addiction is getting younger and whiter as we speak. So that needs to be addressed. I think we can advocate for sober dorms at SU, or at least a floor in an existing dormitory. We can advocate for recovery high schools. I know there's a lot of interest, but I think actually getting some sort of program for adolescents who need treatment and recovery services is way down the road. But I think we need to start laying that groundwork. And we need to advocate for more consistent drug and alcohol education in the schools. They have curricula at every level. And I am not disparaging the Board of Education, but unfortunately what happens is the curricula gets so full that teachers only do what teachers can do. And there's an awful lot of it depends when it comes to implementing curriculum. And it depends on a lot of things, you know, whether or not the unit was left for the end of the year, whether or not the teacher feels an expertise in that area. There are a lot of variables when it comes to teachers implementing curriculum.
Do you know what grade level, Jim, do you know what grade level they start at?
I actually have not, you say they have it, I have not seen it.
Oh, well, I go in, I have.
You have?
I
Okay.
have, because I go in and I talk to the middle schoolers.
Okay.
Okay, so it's
No,
middle school,
regular.
they start in
So,
middle
yeah,
school.
it starts in
Okay.
the education starts in 6th grade, and there are units in grades 6, 7, and 8. There are also efforts in the high school. I know Y High Wednesday morning is having an event for the freshman class, and I will be part of that. So I know that the effort is there, but the implementation is inconsistent, and again, that's no fault of the teachers. But I think we can at least advocate for that. There's a huge lack of qualified, certified addictions treatment professionals. The process to become a peer support specialist is long and complicated, and that's really kind of unnecessary because they aren't really, these aren't education courses they need. It's not an educational certification. And currently, all of the training for peer support specialists is over the bridge. And so we need to advocate, or we would love you all to advocate that Warwick add those trainings to their continuing ed offerings. And we would also like to see the curriculum enlarged for addiction certification at Warwick, at SU, and at UMES. And the other thing that's severely lacking is continuing education training for currently certified people. Again, all of that training is on the other side of the bridge. And that creates logistical nightmares for people who live on this side of the bridge who need to be certified. Now, Warwick has just done their first training where addictions professionals could get CEUs, and we were thrilled to hear that that had happened. I understand they would like to do more, but we're still in the very beginnings of all of that. So the mayor had said, what do we need to advocate for? What do we need to lobby for? Here it is. On the second page, all first responders need to carry Narcan. Our understanding from the people who are in the START task force, on the task force, is that city responders are all equipped. That is not, however, necessarily true countywide or region-wide. So that needs to happen. Any questions so far?
Just one question. Have you looked into the potential of funding from, since the governor has stated a state of emergency?
That wasn't part of our charge to do
Okay.
that, okay? That it wasn't our job to look for funding. Our job was just to make recommendations, to
Okay.
come up with a kind of blueprint for you all
Okay,
to address. So in a perfect world, this is what would happen,
okay.
okay? Page 2, well, actually, page 3 are the things that are in process. Things that have happened since the START task force began. Hudson Center has purchased 300 Union Street. That will be transitional housing for men and specifically veterans. The Oxford houses are looking to buy, but the closing of the Oxford houses that were in operation creates a huge void, and that's a terrible thing. The Douglas Hamilton House, and I have it in the wrong column, it's actually not for women. The Douglas Hamilton House had opened several weeks ago. It's on Division Street, and it has space for, if I'm not mistaken, 14 men, and it's transitional housing. And Hudson Center has purchased an additional building for transitional housing, and has not at this time determined for whom it will be.
Is there a time limit on Douglas? Do you know?
They're
For
open.
transition? No,
Oh.
for time,
No, not as far as I know.
so it's an open,
It's yeah, and it's not treatment, it's transitional housing
Right.
and recovery support.
right?
But I would suspect that as long as you are compliant and paying your rent, you can stay as long as you need to.
Okay,
And that's sort of what needs to happen, because recovery is a very long process, especially early recovery, and the supports needed in the first several years are really, really critical, not the first several months,
okay.
unfortunately. Okay. Youth community centers, the city has purchased one building in the Camden area, and we're planned and budgeted, and we are, hallelujah. That's just an incredibly important thing to address the at-risk youth who who could, without intervention, end up as part of this epidemic. Greater coordination between PRMC, law enforcement, and peer support. Everybody knows that needs to happen. Everybody knows that needs to happen, and everybody's aware. Increased funding was needed to add a coach supervisor, and as far as I know, as my understanding is that position has been funded, if not fully, at least partially at this point. Is that correct? Mayor?
Yes.
Oh, there they are.
From our portion of it is in the budget.
Okay,
Now, most of those expenses are coming from the state's attorney and the health department.
okay.
But our portion is in the budget.
Wonderful. The parity of mental health and treatments addiction reimbursement was a huge issue because so many of the people who are casualties of this epidemic are on Medicaid, and Medicaid was not reimbursing at the same rate as it needed to be, and that legislation has been passed, and it should be implemented July 1, which is wonderful. It's great news for all of the treatment agencies, and hopefully they will be able to better meet the need now that they're getting paid. We already have Narcan access and affordability. The health department does free trainings and scripts. As I understand it, they're close to the end of their money, but it's also very close to July 1 when that would be renewed. Increased funding and increased trainings are needed. Hudson Center provides scripts to every single patient that comes in there. And the Recovery Resource Center does trainings coupled with CPR training 4 times a year. So we're all working on that one. Okay. Any question about that? Okay. Okay, if I'm missing something or leaving something out, Mira, would you say something? Okay. One of the last categories we were given was just do it. These are things that we just need to do. And these recommendations for the city are to support the recovery lifestyle. And what we thought about was having the Arts and Entertainment District sort of take the lead in some of this, because teaching our children how to have fun without booze is as important as any other prevention effort that we do. So we talked about maybe having a concert series in the park. Since the park is alcohol-free, that would be good to renew. I understand at one point there were concerts in the park, and for whatever reason now there aren't. Or if they are, they're fairly limited, perhaps expanding the scope of that for the whole summer season. Outdoor movies showings in the park, using the bandstand. Again, it's an alcohol-free zone, so it would be an alcohol-free event for families. The library does a great job of programming for adolescents, but it certainly could use some publicity, because those programs seem to be kind of the best-kept secret in town. But they are great programs, and they do appeal to teenagers, and they need something to do and a place to go. We also thought about the possibility of partnering with other stakeholders to create some alcohol-free events, not only for families, but for people in early recovery to show their support, and for the kids of people in recovery. Maybe a family night with the Shorebirds, maybe not. I know we're not going to get the whole stadium without booze, but maybe a section. Could be a no alcohol section. A camp out at the Salisbury Zoo. Now, one of the people on the task force, Linda Wayner, has taken the lead on this, and I understand that that is in process. And they will start out small with a workshop, a weekend workshop, and expand that to have an overnight, and again, that would be an alcohol-free event. Bowling alley, 1 night a month without alcohol, perhaps. And this would be something that the city could, or maybe the Arts and Entertainment District, maybe Jamie Heater could take the lead on that. Any questions? Okay, recommendations for going forward. Well, we have this lovely blueprint of things that need to happen, that are happening, and now what do we do? What we're recommending is that this task force be reorganized as the Opioid and Addiction Coalition of the Lower Eastern Shore. This is not a Salisbury or Wycomico problem. It just isn't. And rural areas get hit particularly hard, and the Lower Eastern Shore is a rural area. So with that in mind, what our recommendation is that this subcommittee that sort of started, the subcommittee of the START Task Force has started to meet to plan screenings of the movie Generation Found. Generation Found talks about the need for recovery high schools, the need to take care of the adolescents, the young people who are getting introduced to and addicted to opioids long before their time. We have applied to the governor's office for funding for those, and are planning to do at least one in every county this summer. And from the people that come to those events, create the new coalition, right? Okay. And then have them take a lead, have the coalition take the lead that the START Task Force began. We would like the coalition to look at doing a community conference with a focus on addiction, and we would of course look to Lifemark and Eastern Shore Psychological, Warwick, the Recovery Resource Center, Hudson Center, all of the big players. And big players, that's not a good term, but you know what I mean. The
Mhm.
people who have a vested interest and have the expertise to inform the community about what's going on, how did we get here, what can we do as a community, what can we do as individuals to promote young people not having to get hooked on drugs. And just say no doesn't work. We also would like to see this new coalition really look at a way to bring family support and education and support to the families. The sad reality about the families of addicted people is that if they don't learn how to treat the addict or recovery person differently, those patterns won't change. And that the families need as much education and learning as the addict does to live in recovery. And so we wanted to address that because that's a huge need. So often mom and dad just want to vent or blame or whatever, but they really need as comprehensive an education process as the addict or alcoholic in recovery. So that's the blueprint of the START task force to address the opioid epidemic. Are there any questions?
Can I just add a couple thoughts?
Sure.
So I think, what I've learned from this process, and there's a ton that I don't know yet, and that I am learning. But what I've seen is that the state has done a fairly decent job in terms of leadership on this issue. The county has done an even better job than the state, by and large, has done as far as leadership on this issue. And I think we have to and had to, lead on this issue. So we have to answer to Salisbury first. And that's why I think there was a ton of value in learning from the experts in our community, what is it that Salisbury needs to do and should be doing that isn't the county's job or the state's job? And by the way, what should we be lobbying that they should be doing in the areas of their responsibility? And I think you've given us a number of answers to that question. The maybe more important conclusion is that once we know some of the things that we should be doing, is that we should be working together. And that's what the COAT effort is, and that's what I think our partnership with the state's attorney's office and their heroin prosecutor provides. But you formerly Safe Streets prosecutor, and I think all of that provides that. But this partnership you're talking about, this team that's not focused just on the political boundaries of Salisbury or even Wycomico County, but the whole Lower Shore and even Lower Peninsula, I think makes a ton of sense, and I hope is effective at advocating for additional activities and change in both our healthcare, criminal justice, and educational areas. The biggest thing is education. And I think we know, and what you've been talking about, is that awareness is critical. We've got to be out there talking about it. And that's certainly something that I think I've learned through this process. So I appreciate you shedding light on this situation and teaching us that's, at least teaching me, that's what we should be doing.
My pleasure.
And thank you.
You're welcome. My pleasure.
Any other questions, comments?
Just, are you the head of the START team?
I was the chair of the START task force.
Well, looking at what you're saying about, as many times as you've said across the bridge, someone needs to get with our delegates immediately. Somebody needs, do you want that to be us?
Yes. Honestly, yes.
I should have let the city council president ask that question.
No, go ahead, no.
No,
That's
No,
good.
I
What-
just,
Yes,
if
because
literally, I hate to say it like this, but I'm not so sure you didn't tell us anything we didn't already know. So I'd like to make up the time
Well,
and immediately go to the delegates and the senators and say, if there are not enough counselors at these places, then you've got to get with the president of each one of these places and say, how do we get funding for you to go, you and I talked briefly about an article we saw about Anne Arundel County opening up fire departments and police stations from midnight to 8 for those people who have no place to go. And I think that has to be the next thing
Oh, yeah,
that we talk about.
yeah.
That's
But I'm not
that's a no questions asked.
Yeah, no questions asked. Yeah. You know, if you're here for treatment, I'm not here to judge, and God knows we could use a lot less judgment on this planet. But
Yes, we could. But yeah, yes, to answer your question, yes, because this first page are things that we didn't feel we could do.
we could do, right.
Okay, so these are the things that we need you, as our elected officials, to advocate or lobby for, because we didn't feel like we were in a position to do that.
Then I would suggest this, Mr. Council President, if we could we make an appointment with Delegates Anderton and Carrozza and Senator Mathias and Delegate Sharice Sample Hughes, and sit these people down amongst the big one, like tax differential, we'll save that one for last. At least start to hand them some of these things that are coming our way and saying, this is what we need to, unless you're doing that.
No, but when you asked the question, the first thought in my mind jumped to our legislative lunch.
Lunch that we do.
So this
That's the
summer,
time
when
that's
we're
the
gonna
time
sit
to
down
do
with
it.
them and say, here's what our priorities, I think what we have to do is identify, and maybe it's even, we have to draft the legislation, or work with them to have it drafted by their, bill
Or at
draft.
least flush out some specifics we need.
Yeah, and say,
And maybe
here's a
it,
priority
and
that we
maybe-
want you to take to
and
Annapolis.
and I guess maybe a piece of that could be, if you have a list of programs, the educational program, some of the specific classes and certifications we need, if we have a list of that they're doing across the bay, and say, hey, we need this specific program with these specific classes and certifications, this is what we need. And I think if we have something where it's flushed out, I think that'll even be more, because then that'll also kind of give the schools cost and all that.
And the other thing I think we need to do is, I asked a question before about the state of emergency. What is the procedure? What is the mechanism for us to avail ourselves of all the things that are available to us because of the state of emergency, and how do we go about that? Because we're dealing with our budget now,
Yeah.
and we're struggling, and everybody is. And if we can get some of this from the state, we're much, much better off.
And I think that's that first item, that create funding stream for the intervention teams. Maybe there's something we can apply for under the governor's state of
I
emergency.
would think so, and I would hope so.
But you have to understand the process before you
Yeah.
can get it.
Yeah.
And I think that's one of the places, and I don't know who that's going to be, but we need to find somebody who's going to be the champion of that. I don't know if Mr. Mayor, if our grants people can look at it or whatever, but certainly that's going to be a key issue. The other key issue is none of us at this table are experts in this field except you. And the way to resolve these issues is like we do most of the issues that we're successful at. And I think we have to make every effort to engage the community and find out and get some assistance and help, whether it's financial assistance or help, or whether it's professional assistance and help, and come up with a list of those things, and maybe we can avail ourselves of those services as well. That's all. That's my comments.
Are we talking also about long-term rehabilitation at all, or just short-term?
The transitional houses are more about long-term. What we do at the Recovery Resource Center is more about long-term, but those aren't actual programs in the way that the state might consider funding a program. Did that make sense? Okay. At the Recovery Resource Center, we house 12-step meetings. Now, if somebody chooses to take advantage of that, that's wonderful, and we encourage that, and we're thrilled that we see 900 visits a week, which is huge. But there's no programming per se. There's nobody in charge. There's nobody keeping records or anything like that. And with the transitional houses, there might be some program requirements to maintain your residence in a transitional house as opposed to a halfway house. A halfway house is a treatment, a level of treatment. A transitional house is support. But no, we do not have a long-term treatment program in our area. We don't have a.
Oh, well, I know we don't have
Yeah.
one in our area.
Yeah.
But are we thinking about even, because drugs, and you, as you say, you're a professional, you do know, but 3 months, 5 months, 7 months, 8 months is not just a lot of time for some people, especially someone who has been on drugs for such a long period of time, or even a child who has gotten addicted to an opioid. It's not something that you just, oh, I'm done. No, it's not like that.
No.
So some people require more time, a lot more time.
Yeah, now there is a new organization called Project Out in this community. His name will come to me in a minute. His first name is Robert. I can't think of his last name right this minute. And he was invited to be on the task force, and he did not come to any but the first few meetings. So I don't know where that project is in its evolution. But I know that they have a board of directors, and they are pursuing how to make a long-term treatment program possible as a private nonprofit, not as a government treatment program. A lot of the long-term treatment programs, the 6 months to a year to 2 years, are private nonprofits. We just don't have one yet. We need one.
Yes, we do.
So two things that just came across my one email. Is SAMHSA, do you know what that is?
Samsha?
Yeah,
Yeah.
okay. They just announced a grant opportunity that just became available. And we've got until July 3rd, so that's one funding source that we could potentially consider. And it's to mobilize resources within and outside of the recovery community to increase prevalence and quality of long-term recovery support in cities without those resources. And then Chief Duncan here just shared $50 million that has become available for prevention, recovery, and enforcement from grants from the state. So two potential significant sources for us to look into.
Thanks, Chief. Keep finding the money. Any other questions?
I would suggest that we, since you didn't get, for whatever reason, any sort of decent response from the hospital. From my experience before, you run into a hospital doctor in North Carolina on vacation, and your first 2 days of vacation get taken up with, can you come talk to me about what's really going on in the emergency room? My family was none too happy about my disappearance over those first 2 days that year. But it would seem to me that if we were going to get more concise numbers of what's happening here, we need to go and spend the night in the emergency room. All of us, to be honest with you, because that's where I think more gunshot wounds than are reported, more stabbings than are reported. I think all of that is right there. So if we are, as a group, considering respectfully the space that we have on our agendas coming up, if we want to be ready for a breakfast with our
Done.
delegation, let's really be ready. If it means we take a work session and we meet with doctors over at the emergency room, or we spend 3 or 4 hours there, you know, watching exactly what's happening, or that 12 to 8. I wanted to be clear to the delegates and the senators and the governor that it is the rural areas that are hardest hit, not because of per capita, the number of people, actually per capita we're probably higher than some of the cities because, but that the resources aren't there. I also, in full disclosure, these houses, though legal, are very difficult for neighborhoods to absorb. So I'd like us to be working towards making it so those houses aren't particularly necessary, and that they aren't a financial windfall for the person who decides to take them on. So I would just suggest to Mr. Heath that if we're gonna do this, let's go do this. I think it's worse than we think, and I think it would be
It
good to have
is.
firsthand.
It is when you're in the store and
Mm-hmm.
the paramedics are called because
Yeah.
somebody's OD in the bathroom.
Yeah, and these pictures that are showing up online now, it seems to start to be a cottage industry. Let's find somebody having an attack or having an overdose. I'll take a picture of them because, make America great again.
Okay, thank you very much for your work.
You are very
Um,
welcome. It's my
thank
pleasure.
Oh, yeah, and I guess the next step, and Mr. Mayor, I don't know how we want to do this, but the next step was to reorganize the group, so is this?
Not a city function, but the
This is-
coalition is assembling.
Okay.
And I think we could certainly ask that they communicate with us in a formal
And
way.
I would like to be a part of the new as well. so.
Okay. Right now, it is, there are 5 of us from the START team, and we can certainly invite you. We would be glad to have you. Our next meeting is May the 24th at 10 a.m.
Okay,
at United Way.
okay.
And we will keep you posted.
Great.
We will keep you posted.
Thank you very
Thank you.
much.
So
Thank you
much.
for your time.
Appreciate it.
Thank you, Ben.
Okay, Mr. Molds, you're up.
Good afternoon.
Good afternoon.
Speak into the microphone.
Good afternoon.
Thank you.
Department of Public Works is requesting a budget amendment. We have a shortfall in our electricity budget for the water treatment plant. And we're dealing with several of these type of shortfalls. We've been able to handle them through budget transfers. This one, because of the size and because of the way the accounts are set up in finance, I need to do a budget amendment to transfer funds from the wastewater treatment plant account to the water treatment plant account. That was set up by finance a long time ago. So we're looking at a $72,000 shortfall in the water treatment plant electricity account. And we're able to find those funds in the wastewater account electricity. Both those accounts are very sizable accounts. The water treatment plant account was budgeted in FY 2017 for $290,000. We waited till we got the third quarter projection from our energy consultant, and he's projecting about $362,000. One of the things that was brought to our attention was that there's a rate increase.
Did the consultant give you an idea of why he was off by
Well, that's
$100,000?
Well, one of the things that we had when we saw.
Sorry, I've been through it with this consultant for 6 straight years.
What we did when we saw some of this coming down the pike is we had Mr. Anderson come out to the water treatment plant and take a look at our electrical usage and systems and identified some things that he wasn't accounting for in terms of heating loads and things like that. So we wanted him to do that so we could make projections for
And
the
how long has
upcoming
Mr.
budget.
Anderson been our consultant?
He's been there as long as I've been here,
Right,
but
well,
I
if
don't
you
know.
don't know that they're there, then it's time for you to consult somewhere else.
That is something.
I
Pass
mean,
on your
I'm not,
procurement.
it
That's-
doesn't make any
understand.
sense to me, Jack. I think if you
That's
look
a
at these
20,
sheets.
that's a 25%
Miss.
miss. So either we bought some very, very expensive new equipment that's causing us to use more electric,
Right.
or the rates, because I know the rates didn't go up 25%.
No, I'm not saying that did. It was I think a 4% projection increase on delivery of electricity. So we used the projections when we put the budget together. When the budget was adopted, there was a reduction in that budget. I think because there was an energy contract, we were gonna get negotiated to see some price decreases. I don't know whether they were materialized or not. So that's what we're dealing with. Fortunately, like I said, I've been able to find money without having to go into surplus to do that.
I think what I suggested to him one year is when you're off by that much, we'll either take it out of what we pay you or you can pay the difference since you are supposed to
There you
be
go.
the
Well,
consultant.
Yeah, and
So
I,
can we put that on the list of future things to talk about energy consultants?
well, I think that,
Even now, I'm sorry.
I think what it brings up from a business perspective is you have a performance, a performance guarantee that you put into the contract. And say if you're outside these boundaries, you're responsible for them.
Right?
And the performance guarantees are done in different ways.
I can't speak this for sure, but I'm asking Julie, but I'm not sure we are under a contract. I think we're in rolling services with him. I don't know, Jim, if you remember ever signing a contract with him, but I don't.
All I remember is that my head wanted to explode every time I was in the presence of
I think
Mr. Anderson.
I think a performance guarantee contract would be a great way.
Put out an RFP.
Absolutely. I don't know what the norm is in energy consulting services, but I would have to think that somebody's done a performance guarantee contract with somebody else for energy services consulting before.
I mean, certainly there's sometimes things that are out of, you don't, the rate goes up or whatever, that's understandable, but,
Well, and
you know,
and think
something
about
like
it,
this.
this year, we've got it in another account. What about next year,
Right.
Yeah,
when we don't?
Is there any trepidation about transferring it from the wastewater treatment plant, which we've had conversations about what the electric's gonna do when they're, or is this just Mike needs to pay this bill and we need to move in a different direction? Would you
Yeah.
say it's that?
The thing on the table here is we need to pay our bill, so we have found money to do that in a bunch of different accounts.
I'm willing to say, what's Delmarva Power gonna do? But I'm pretty sure I know the answer.
well, yeah, I can tell you what the answer is.
Anytime you think the power bill, don't forget the power company.
We should have bought every variable piece of land.
Okay, so who wants to get the power shut off? I think, okay, does anybody have any issues?
Pay the bill.
Okay, all right.
I think we've got an idea what we want to do.
Yeah, I think going forward, we need to handle it a little differently, that's all. Okay, thanks, Mr.
Thank
Williams, appreciate it.
You already got it. She's already got it. She's already emailed it to me.
It's like, before I forget, let me just make an announcement that at next week's meeting, we will have a public hearing on the Fenzel-Olney Road annexation. So that anybody that's interested at home, and you, in regards to this issue, please come and come to the council meeting and let your opinion be known. And we will also have the proposed budget, water and sewer rate, and the fee schedule and constant yield discussion at the same time that night.
Tomorrow is 8:30?
Tomorrow is 8:30. And we will finish tomorrow, whatever time it is.
All night.
No, it will not take all night. Will not.
If possible then, the asks that I gave a couple days ago about what
They're
1
gonna-
cent is, I know that's for tomorrow.
Yeah,
I have a hard time with accepting the fact that it's supposed to be done tomorrow when my questions and my suggestions were based on knowing what those numbers were 4 or 5 days ago. So I'll do my math. Is Mr. Cordry going to be here?
Well, yeah.
Okay, good.
yeah.
Then
It's
I
gonna
don't
be
have
for
to
that
But I got
session.
an email to you, that'll go out to you right after this meeting.
Okay, that's fine. If we're going to discuss the rates and discuss each one of those things, I did not want to come in with well, I don't like this, but I don't have anything to offer you. I mean, I'd like to offer you something so Hardy can go, the market can't handle it, so I can't support it, so, I will do my best overnight then to try and come up with some suggestions.
Okay. Anything else for good of the order? If not,
Awesome.
we're done.
Good, I'm going to get you out.